What is beautiful bone structure? If you're a clinician who is treating patients or a patient seeking to be more beautiful, first thing you need to understand is bone structure. The bones or the skeleton are the underlying structure of our face on top of which all the other structures sit. So they really are the foundation of beauty. But not many people talk about what it is about bone structure that makes people attractive in a way that you can use in your clinic or as a patient seeking treatment. So in this episode, we're going to discuss beautiful bone structure, what you should be looking for, what is treatable and what is not treatable, and what happens when you overtreat or go too far. We'll also be understanding the difference between male and female and why this is really at the heart of what beauty is. If you're anything like me, the first time you inject a cheek, a chin, or a jawline, you suddenly realize you need to understand bone structure. What is it that you're actually aesthetically trying to create with every injection? Many trainers will focus on safety, depth, and position, but what about the aesthetic? How do you know when you need to inject, when is too much, and when it's just right? This is at the heart of medical aesthetics. I learned a lot about this through sculpting, something I recommend all clinicians try at least once. If you take the time to sculpt a clay model using what you think you understand, you'll see how it plays out in reality, and you'll see the gap between what you understand and what there is still to learn. Back in lockdown, I thought I'd use some of my additional spare time that I had to learn to sculpt. And I really started to struggle against what the actual details are that make up the human face. Ultimately, proportion is very useful, but it really isn't what the structure of the face is made of. You need to know something higher level than simply the golden ratio. What is the ratio between? And it's these points, planes, and the lines that form the three-dimensional shape of your face which really become useful for everyday injectors. On this model on the left, you can see the planes of the face, which ultimately are what your eye sees. Our eye really sees the combination of light and shade caused by these planes reflecting a pattern that our brains turn into something that means human. Our brains are also primed to make meaning out of that, and we're looking for youthful, healthy individuals to build relationships with. That is ultimately what aesthetics is really about. What do humans find attractive? It's health, gender, youth, symmetry. All of these things form a feeling that we get. And when someone is beautiful and meets these in a way that we find attractive, we want to spend more time with them. For many clinicians, the first concept we are introduced to is the golden ratio. This was first identified by Leonardo da Vinci, and it's a ratio that we can see all over nature if you look for it. I think the best evidence that the golden ratio is useful is simply to look at the proportions of the face. The strongest and clearest signal I see is that the width of the intercanthal distance, that is the distance between your eyes, seems to be the same as the width of your eyes, which is the same as the distance from your eyes to the end of your cheek in beautiful people. This also correlates to the width of the nose and the width of the chin in females. That same intercanthal distance, when multiplied by the ratio of 1.1618, ends up being equal to the distance of the chin and the mouth. These ratios are incredibly prevalent, and you can see them across different races and nationalities. And for me, that makes them incredibly useful. You can make clinical decisions based on this ratio. The problem is this is very useful if you're drawing a static image. But what if you're creating a three-dimensional structure? We need to know more about the details of that structure. And this is where bone structure becomes more important. What is it about the structure and the shape of a bone that makes it masculine or feminine, beautiful or less beautiful? And this really is what we are most often tweaking or treating in the clinic environment. We are changing the proportions of the defining points of these bones. We make them look bigger or more projected or more refined depending on what we do. And this is what injectors are constantly trying to hone and do well. To do it well, we must understand the details, not simply the ratios. So let's review the bones of the face. These are the bones we're often trying to emulate with certain injections. We're either trying to make them look more prominent or hiding them by blending them in under what will be perceived to be a layer of additional fat. So if you wanted to make a forehead, for example, more masculine, you might be projecting the bone more. If you wanted to make it more feminine, you're hiding these contours. But which contours are we actually talking about? In the forehead, we have the frontal projection. In a man, this is typically bigger, and you can see this often quite clearly on me with downlights. But it's also important to see that in men, we also have a stronger periorbital ridge and labella line. So this dominance here, there are 2 points on either side, often where the corrugator meets, that are often more angled. And then we have the periorbital projection here. The bigger these are, often the more masculine the face looks. The smaller and the more blended in they are, the more feminine. The midface is defined by 2 main bones. We have the maxilla centrally, which should be projected relatively strongly in the ideal face, and the zygoma, which similarly in a man is projected more anteriorly, but in a woman is relatively projected laterally. This sexual dimorphism, essentially that word simply means the difference between male and female faces, which allows us to clearly recognize male and female, an essential part of human survival. The lower face, of course, defined by the mandible. It has two defining points in a male on the chin, and usually one or two very central points in a female on the chin, which are narrower together. And then the gonial angle, which is wider and broader relative to the zygoma, which becomes the defining point of the lower face. In men, this is a significantly bigger bone compared with the female, which is one of the ways the skulls are identified forensically as either male or female. These videos have gone viral on Instagram showing the importance of a strong chin. And this is one part of the coin. If you can create clear definition at the base of the whole of the human head, it becomes what I see as the base of the presentation box of the eyes, essentially the apex or the lower structure of the face that makes everything else look part of that structure in a seamless way. The problem is you can also make chins too strong, and this then becomes masculinizing. And this is one of the key points to remember if you're thinking about dermal fillers as a solution to chin weakness, is that everything you do to make chins bigger also has the risk of making chins look more masculine, which can be your goal, but often isn't. Often we're just trying to get just that balance between definition, structure, and then overdoing it, becoming more masculine. So that narrow focal point, being very aware of the details, the lines and the planes that connect the chin together with the rest of the face, can help you make good decisions about what will actually enhance beauty and not go too far and create a more masculine appearance. Although strong chins are important for both male and female beauty, it's important to understand the difference between the two. A strong chin in a female might project down and anteriorly quite well, but it shouldn't be wide. And that's really the big difference. A male chin tends to be wider, the width of the mouth, with two angles, whereas a female chin tends to be narrower and finished with a rounded or at least two closer together defining points on either side. And this is what makes them more feminine. Classically, textbooks will say that the chin should project no further than the bridge of the nose. But if you look at many A-list celebrities, they actually break that ratio all the time. My observation is a strong chin that projects beyond the nasion is more beautiful in many people. Certainly more striking or statuesque as opposed to more baby-face beauty. But what if a patient presents with a strong jawline that's too masculine? Is there a way of feminizing it? Well, there are a couple of things that you can try or consider in some people. The first is have a look at the other defining points of the face. What is happening in their cheeks and their nose, and is there a way that you can make those structures a little bit more dominant to make the chin softer? You can also sometimes blend in the angles to make them less vivid. So if you have a very well-defined angled chin, if you rounded it, sometimes that makes it less vivid. But I would say anything where you're adding more volume to a structure that's already too big is quite highly likely to make it bigger rather than actually make it softer. That is with one exception. Can you atrophy the muscles that create some of that definition? For some people, a strong mentalis might be adding to chin projection, and the master is often part of lateral projection of the jawline, and something that you can shrink using botulinum toxin to cause muscle atrophy and narrow the face. So how do we take all this information and apply it to medical aesthetics? What's going to happen when your next patient comes into your clinic? The first thing is they also need to understand what it is that you're actually aiming for. So get clear on what it is that you believe makes up a beautiful chin. For example, if you're treating a female, we want to see certain points very clearly. A gonial angle, a chin angle, and a line or a shadow that runs underneath the jawline that frames the face. Now, if you can make that better with injections, then that's what we should be recommending. Often this is not amenable to injectables, and a good clinician will give other options as well. But if you have a patient who simply needs a more vivid structure so that you can see them more beautifully, this is what a good injector will provide. Let's think about what we might do as a technique if you wanted to make a patient more beautiful by injecting their chin. The first thing is, are they male or female? Male faces require stronger, more angled structures, and you may be trying to widen the chin and make it squarer with injections that make the defining separate points on the chin more clear and the defining point of the gonial angle, and preferably as wide as the zygoma. In a female, it would be a different approach. We still would ideally like to see a gonial angle, though it is smaller and of course always narrower than the cheek. For many patients, you won't be able to see the gonial angle well because of adipose tissue hiding that structure. This is not something easily amenable to injections, although some fat dissolving injections can help a little bit. Otherwise, it is weight loss or other surgical interventions. In terms of treating a female chin, we have room to cause a little bit of projection, but remember always to make it narrower and not to make the lower third of the chin bigger than the golden ratio, or they start to look a little bit masculine, even if it's a narrower chin. There are 3 planes to look at: anterior projection, the width of the chin, and the length of the chin. Any one of those ratios that becomes too big will make the female look more masculine. So you really are limited, and this should be planned carefully before you start injecting. I'm going to show you on this model how important bony proportion is in terms of overall aesthetic. We'll see what happens when you overlay aggressively the structure of a male skeleton onto a female face. It really is the underlying reason why people have a particular facial shape. So have a look in this model as we first start on her jawline. The jawline is potentially the most dominant area in terms of what makes for a masculine or a feminine face. So as I increase the proportions of the gonial angle, of the defining points of the chin, of the length and projection of the chin, you can see that she becomes increasingly masculine. This is no subtle thing. It is a dramatic change that would make a huge difference. If you actually did this to a patient, it would be devastating unless they actually wanted to look more masculine. In a more masculine face, the whole width of the face is wider, but remember that the gonial angle is still typically equal or greater than the angle of the cheek, which is what you can see in this model. The width of the nose also makes a face more masculine. The wider it is, the stronger it looks, the more masculine it is. From a side profile, this also means greater projection. The angle of the nose is also something that represents an area of sexual dimorphism. We want female noses to be angled upwards. As is this model's natural shaped nose, it's a very feminine shape. As you create a more 90-degree angle, even beyond, it becomes much more masculine. The eyes also, as you can imagine, have many indicators for masculine or feminine. If you make the frontal bone and the shapes of the frontal bone more caricaturish, as in make those natural subtle curves project more, you get a more dominant periorbital ridge. The periorbital ridge in a male is also lower, and the frontal projection of the frontal bone is also bigger. So as you reveal these structures, it is both masculinizing but also associated with some age progression. You tend to get more visible anatomy as you get older. Understanding this will also help you understand why sometimes younger women treated with dermal filler in appropriate amounts sometimes look older. You've enhanced what your brain sees as the underlying structure projecting through, which typically happens more with age. And this highlights one of the most delicate parts of medical aesthetics, which is these gentle transitions between structures. It's very easy to create an angle on any particular bone, a chin or a jawline or a cheek. But how do you get that just right so that it flows easily and gently into the next structure without looking over-defined? It's over-definition that both masculinizes and sometimes ages a face, and something that all injectors need to think carefully about. In my model, this is the connecting planes that we use. Defining points need to blend gently together with the connecting planes as seamlessly as possible.